Hello, welcome. So tonight's tutoring session is we're going to discuss magnification factor. Before we jump into it, I want to encourage you, it might be test taking time and you're working hard with studying. I want you to know that you can do it, hang in there, little by little, um, committed action. Sometimes it's hard to get into the groove, or sometimes it's hard to get away from the distractions. I encourage you to get into your own study environment, the one that works best for you with the least amount of distractions, and really give yourself the time and the space to put your all into this. You can do it. You're going to become a great radiation therapist. I believe in you. So let's get started. I'm going to share my screen. All right, let's check in with you guys. How is your studying going? I always like to start from where are you at and where do you want to go? So did you accomplish your study plan? Some of you said you're going to be dedicating lots of time each day. I hope you have been able to carve out the time, actually set aside what length of time is going to help you prepare for the exams, not what time is left over in your day, but what time is going to move the needle to get you feeling confident on test day. Some of you jumped into lymph node review through Laura Nappy's course, jumped into learning TD55s, understanding the physics and what energies pertain to certain reactions, and taking practice tests. So using those practice tests as a good gauge, but not the end all be all. They're not perfect indicators of what's going to be on the test, but if you can feel comfortable as you go through the practice exams, for the most part, understanding or at least recognizing most concepts covered, I think that'll be a good place to start from. And then dig deep and teach yourself the things you got wrong. So if you've gotten something about activity wrong, go back to last week's lesson and watch the video and jump into maybe a physics book if you own one. I used Khan, and that was really helpful. But not having to start with the whole physics book, of course, but just looking in the index, starting there. What topic was it that got you? And skimming for, that topic through the book, through the index, or through the table of contents to get what you're really looking for. And don't spend a lot of time doing it, but once you feel like you've gotten your handle on where it's located, just skimming the paragraphs in that section, looking over the practice questions to see if they were similar to the practice questions that you saw on the exam. But teaching yourself and starting from a point of, I don't know, let me find out, is a great place to learn, because learning is optimized when it's relevant to you. So, second question, how effective were your study methods? And how was the length of time you gave yourself to study adequate? Did you stick to your goal length of time of study? And oftentimes, it's not all about length of time and you got to do 16 hours a day, 12 hours a day. You actually want to study healthy amounts, but not overwhelming amounts, because at some point, and you may have experienced this, where you're feeling like you just can't make it through these as you read or as you go through the topic, you can't wrap your mind around what they're trying to say. And you might reread the same sentence or go back over the same part in the video multiple times. And that might be a clue that you just need to take a break, stop and go for a walk, get some fresh air, come back to it when you've reduced your cognitive load. And that's oftentimes, it's either you've reached your cognitive load, your capacity for learning in that topic, or if you find yourself rereading maybe the same page of text and you just glossed over it, but you're not really getting what it's trying to tell you, That could be where you're actually understimulated. And so you may want to dig in, not just by reading, but writing notes by hand, organizing the notes, and see how they relate to other topics that you're familiar with. And that leads us to the next point. Did the material connect with what you know? And again, relevancy in connecting it to your experiences in clinic, your experiences in class, your experiences in what you've read and digested in the content so far. How does this relate? It's a great question to start. So let's get into it, shall we? Magnification factor. So magnification factor, if you were to distill this down, I have a couple of slides, but if you were to just make one point out of this, it would be that magnification factor is present in all the images that we take. We can't get around it because we're taking images of three-dimensional people, and as a result, the divergence from the X-ray source will acquire the image some distance away from the image receptor. Why am I even saying all this? It's that magnification factor, the fact that magnification exists, is largely, or the only reason it exists, is because of divergence from the source. And so because radiation diverges, the further an object is away from the image detector, the more magnified it will be. So when I said if you were to distill it into just one point, it's basically magnification factor is simply a ratio that expresses how much bigger the image is compared to the actual object size. So if I were to take a moment and kind of write what I'm trying to say for you, let's see if I can move this. All right. So if I'm writing what I'm trying to say, it's magnification factor equals what the image appears to, it's the size of the image and how much bigger it is compared to the actual size of the real object. And then there's another way to express it that is a little bit more fancy, and that is an acronym for source to image distance and an acronym for source to object distance. When I say source to image, it's really image detector distance, detector. So this picture is trying to describe how divergence plays a role on this person. Imagine that's your patient. And so this is a concept that's typically talked about in radiography, but it's impactful to us because our KV images that we acquire weekly on some patients, or our MV, megavoltage images that we acquire sometimes weekly, or for at least initial fields for 3D CRT patients, will utilize some sort of portal imaging where we're shooting X-rays at the person, acquiring an image on the image detector, and this can help us understand how to understand what we're looking at. Sometimes we're faced with looking at a two-dimensional image of a three-dimensional person, and we need to be able to look at it and interpret, okay, maybe I have a profile of something of maybe two limbs, and I have to decide which one is the affected limb, which one, say if I'm treating a right femur, I'm taking a portal image of it and both femurs are right side by side, I have to decide, which one is the one I'm actually trying to locate to. And by doing so, you can actually, by understanding one of the ideas of magnification factor, you're going to be able to understand, what I mean by saying it's going to help you localize the actual femur you're dealing with. So stay tuned. I'm going to erase this and moving on. So magnification factor, I kind of touched on some of these things, but basically it's, if this were the source of the x-rays, down the central axis, there'll be no divergence and there'll be no spatial magnification. But that's not useful to us. Things are, in real life, things take up space, and because they take up space, or at least meaningful things that we image take up space, and because of that, we're going to get magnification. Now we can reduce magnification, and this diagram kind of demonstrates that, the closer the object is to the source, you can imagine this circle that you get on the image detector is actually going to get bigger. Alternatively, imagine the closer you bring this object to the source, the smaller. It's like a shadow, right? Think of it like a shadow. The smaller the image on the detector will be. So really, it depends on how far away or how close the object is from the detector. So as I kind of talked about in the last slide, magnification factor contributes to spatial resolution. And spatial resolution is a concept where, say you want to, really this pertains to radiography, but say you want to compare two anatomical structures of the same density, spatial resolution needs to be as faithful to real life as possible. So as not to, you wouldn't want to have distortions of any kind, especially spatially. And I'll show you what I mean in the next slide. Well, maybe not that. Here, this slide here. So this slide actually demonstrates some spatial resolution here in the femur. So there's three different images of the head of the femur. And it looks like this head of the femur is shortened. This one is lengthened or long. And this one is just right. But they go to show you, and if you can see how these were acquired, patient positioning is important. Because depending on how these patients' feet are turned, will actually give an unrealistic depiction of the head of the femur. Again, we want to have the most faithful image possible in radiography, in the concept of radiography. So turning the feet at a slightly inward posture helps provide access to the head of the femur to have a faithful spatial representation of the anatomy of the neck of the femur, as well as its length. Not the toes not pointed too extremely inward, and the toes not pointed outward. All right, so these are just some points where this may help your practice as a radiation therapist. You may have control over some of the settings. Some of them may be automated. Where I work, we actually are able to control the KV and mass, and doing so can help us to minimize overexposing the patient, because we want to achieve ALARA. So only as we want to give doses that are going to be therapeutically helpful to us. We don't want to overexpose anybody and give them more radiation than they need to acquire the image. And sometimes more is not always better. So in this example, this would be on a film, like a true radiograph film, and this is a digital. But they show a similar progression and how they're related on each. So this is overexposure. This is underexposed. And so you can see on traditional film, you're underexposed and it's too bright, very bright. And on the overexposure side, it's too dark. The idea being that if you want to image something, you want to be able to image it clearly, seeing the detail with appropriate levels of contrast. So, however, on the digital, it actually, overexposing it doesn't make it too dark. What it does is it almost washes it out. It gives it a washed out look. That's not a technical term at all, but you lose detail and contrast. Again, not having a very helpful image when it comes to understanding, the structure and where things end and begin, which may help you aligning the patient accurately. And underexposed here. So one reason why these actually look somewhat decent is there's an automatic image control feature on these digital imaging detectors, where they have more wiggle room for underexposed and overexposed, where they can actually adjust the image into something more usable. So this is, this one's a little grainy, and it doesn't seem like much of it has penetrated. I would probably be able to use these two definitely to, say, align something for our purposes in radiation therapy. But anyway, so when it comes to optimizing spatial resolution, you want to make sure that, like we discussed, the anatomical structure, whatever you're imaging the patient, is as close to the image receptor as possible. This isn't really something we can control in radiation therapy, as we'll see in the next slide, and as your clinical experience will tell you. Oftentimes the imaging panels come out to a predetermined location. There are instances where you can get extended distance for clearance necessity. This, extended distance on these imaging panels does have possibly not as desirable consequences or results, right? Number one, you might image the electronics of the panel, which is not ideal. It shortens the length of lifespan of the panel. Electronics. You might also it's as long as you have a good picture that's identifiable and able to align, it's not a huge deal, but you will introduce magnification. So those are the two things that I can think of. The other thing to optimize spatial resolution, besides placing the patient as close to the image receptor as possible, is also just, correctly positioning the patient, as in this example. Um, you know, this might be something like when you're simulating um, like a pelvis patient, say a prostate patient, you might turn their feet slightly inward to get an optimal position of the neck of the femur. Um, it may not have a lot of clinical significance, but it is a practice that we do um, where I work. It'll help you get a better, more accurate image. You also want to remove artifacts. In this example is an image artifact. Someone left a cell phone on their person when they took their abdominal x-ray. So removing any kind of radiopaque objects when you're imaging. And this is really important because if the ISO center is somewhere here, that's like smack dab in the way, or even if it's adjacent, or we don't necessarily want the beam going through it. So just getting it out of the way, right? And the other thing you can do to help, for optimizing spatial resolution, is you can decrease motion artifact by decreasing the time of the radiograph's exposure. So, there's two elements when setting your mass, and that is MA and time. And so if you can decrease your time and boost your MA in a ratio that gives you the same kind of mass as you might want for the penetration that you're looking for, but keeping the time low is going to help you not get blurry artifacts, especially in the chest, as you might get motion artifacts with the lung, the movement of the ribs. And it's usually not a big deal, and it's definitely not a big deal for MV portal imaging because they're so penetrating, you're not going to see the ribs anyway. But for like KV, you can keep that in mind, especially if you're lining up, if ribs are part of the thing that you're treating. I treated a gentleman who we were treating, I think, a chondrosarcoma of his ribs. And it was important to, capture an accurate representation of where his ribs are and accurately aligned to his ribs. All right, so I'm going to delete this. So this is kind of what I was talking about before, about how I have used, and it's been pretty helpful, how to discriminate or identify the proper femur. Say if we're treating a femur, I'm not able to get a cone beam because the patient, the positioning on the table won't allow for a full rotation of the cone beam, and I don't have any half rotation settings at my disposal. So I got to take portal images and say I'm treating, the right femur or something like that. I'm going to switch this. Number one, like, ask yourself, what view do I have of this person's body? What's the beam's eye view? This is the posterior. This is the superior. Is it a right lateral? No, it's a left lateral. We're looking at the left side of the patient. Say we're treating the left femur. Can you identify which femur? Is it this femur? Or is it this femur? That is the left. The left femur is going to be the largest, not the right, the left on this left lateral image. And so that is because the image detector is on the contralateral side. It's on the patient's right side. Therefore, the right femur is going to be not as magnified or smaller compared to the left. So the left is has greater magnification because it is furthest away from the image detector. Similar to what we have here in this diagram, right? So as the source, and if this is the image detector, the left is closest to, our beam's eye view, right? That's an eyeball. So beam's eye view is what we're seeing here. And so you can tell, like, even though this is me trying to draw the same size object, since it's further from the image receptor, divergence is going to make the left femur appear larger. And so next time you look at a radiograph, now you know the femur furthest away from the image detector is going to be largest. All right, so this is what we work with, right? Linux. And so we see the image detectors. Here's the KB image detector. Here's the MB image detector on an Electa Linac. Here's a Varian Linac, and the MB detector is here. KB detector is here. And they, like we talked about, they usually come out to a standard location. The Varian, at least the one that I'm familiar with, you can set an extended distance capability to get more clearance when you acquire the images. This is an example. So this is the process by which, right, we receive our images. That these flat panel image detectors capture X-ray images, whether KV or MV, and converts them to digital format. So we're able to compare, the live image to the DRR, the digitally reconstructed radiograph, to locate isocenter in some cases, where these days we do a lot of image registration where it's just overlapping the images upon one another. This is where we get into the actual formula. We just kind of talked about what we might have experienced in clinic, what we can learn from this, and why it's, part of our lives. It may have a very, very, very small chance of being on your test, but it's good to know and be familiar with nonetheless. So, like we talked about before, magnification factor essentially describes how many times larger the image appears compared to the actual object. And how would we represent this? It would be the actual image size, how the ratio, how much larger it is compared to the object size. So the magnification is most always going to be in terms of greater than 1. You're usually going to see it. So when you evaluate answers that are answering the question of what is the magnification, if you see answers less than 1, it's probably not going to be correct, because we're talking about how much bigger the image is compared to the object. If the object's always in front of the image detector, the object's always going to appear larger on the image. So how much greater the image size is compared to the object. So it might be 1.5 times larger than the object, could be 2 times larger, could be some sort of fraction like 1.2 larger. That's the kind of like answers that you're going to see. And now it can also be broken down into something a little bit like we talked about with these acronyms. The magnification factor can also equal SID over SOD. And what is that? Well, if this is the source, right? The object is here, and the image is here, image detector. Then your SID is the distance between the source and the image detector, right? It's the source to image distance is this right here. It's from here to here. And the source to object distance right here, SOD. And so again, we're comparing how much larger the image is compared to the object. So whether we're talking image size and object size, like literal, like it's, image size is 1.3 millimeters. And the object size is 0.8 millimeters. You might have a question where you actually have to, since these both equal, these are different ways of representing magnification factor, image size over object size or SID over SOD. You can actually, and you may get questions that will ask you, given the object size and the image size, and the source to image distance is such and such, how far away is the object from the detector? So it's asking you maybe like, what is the source to object distance? And to figure that out, you would actually have an equation that you could mash up these two. You'd connect these two equations. So image size over object size equals SID over SOD. And you'd solve for SOD in my example. So, if they gave you this, they gave you that, and they told you how far away the source to image detector distance was, then you could solve how far away the source to object distance is. So that is, you can just solve the magnification factor if you have the image size or object size, or if you know the distance from the image detector from the source and the object distance from the source. You can just solve like a magnification factor, and you might get like a number of 1.3 or 2 or 6 or what have you. All right, I think it's better experience. So let's move on to some practice problems. We have 3 practice problems. So let's just get cracking. So feel free to pause the video and work this out on your own, and then we can come back to working it out together and see if you got it right or where you went wrong. So what is the actual size of the fiducial markers in the patient at a distance from the source of 88 centimeters when they appear 4 millimeters in width on the image that is taken 120 centimeters from the source? Ooh, there's a couple of things going on. So we got different units, right? 4 millimeters, and we have centimeters. And then we have 3 bits of information, 3 pieces of information. So this might be a scenario where, we do our little thing here where we have image size over object size equals SID over SOD. All right, let's reread this and see if we can plug some numbers in. I'm going to draw a little diagram here to try to make it a little easier, right? Here's my source. Here's my detector. There's the patient on the table. And so this would be source to object distance. And this would be source to image detector distance. See what we got here. What is the actual size of the fiducial marker? So now there's like a little fiducial marker in this person. Who wants to know, I always like to circle what I'm searching for, what I'm solving for. So it says, what is the actual size? So we're going to do the object size. Because object means actual. It's the real size, right? So object size. What is the object size of the fiducial marker in the patient at a distance from the source of 88 centimeters? Okay, so SOD is 88 cm because it's talking about the markers are a distance from the source of 88 centimeters. And so the markers appear, the word appear signifies that it's image. Images appear, objects are, right? So this is objects are real, the actual is a clue that we're talking about object, whereas appears is the key word that talks about image. So the image appears to be 4 millimeters. So I'm exaggerating this, right? Big time. But so imagine this is the image size. That's 4 millimeters. We're solving for this. So do you think, first we can ask ourselves, do you think it's the object size is going to be smaller or larger than 4 millimeters? Well, according to this diagram and due to divergence, if the object is a certain size, the image is always going to be larger, right? The image will always project larger. So the object size will be smaller. The object, if the image is larger, that means the object is smaller. So, okay, it doesn't really help us narrow any of these down, does it? Okay, I thought it might. All right, so they appear 4 millimeters in width on an image that is taken 120 centimeters from the source. So it's talking about image is taken 120 centimeters from the source. That's talking about source to image detector distance. All right, cool. So we got 1, 2, and 3 pieces of information that we know what they are. This is the image size. Okay, so now we can start plugging things in, right? All right, let's plug things in. Okay, so might also help to get things in the same units, right? Because we're going to be cross multiplying. So I kind of want to get things in the least common denominator, right? I want to get things in millimeters. So I wonder if that's, yeah, let's go ahead and do that. What is 88? How many millimeters does 88 centimeters have? Well, is it going to be a larger or smaller number in millimeters? Well, since millimeters are smaller than cm, there's more of them that go into 88 centimeters. In fact, there's by a factor of 10. So to get to millimeters, we actually multiply by a factor of 10. There's 10 millimeters in 1 centimeter. So that means the centimeters cross out, and we have 880 millimeters. So I'm going to write that here, 880 millimeters. All right, same thing for 120 cm. So we go from, and how do I know I'm going a factor of 10? Well, centi means 100, and milli, for millimeters, right, means 1,000. The thing that separates these two numbers is an extra zero. So what this relationship is if you want to have 1,000 units and you're here at 100, to get to 1,000, you have to multiply by 10 to get 1,000 if you start at 100. Anywho, back to the conversion. So we are multiplying by 10 millimeters in 1 centimeter. Centimeters cross out, we're left with millimeters, and we multiply by 10. That gives us 1,200 millimeters. So we'll write that here, 1,200 millimeters. And now we're all in millimeters. So now we can just like plug and go, and this is going to be great. And it makes sense. Our answer's in millimeters. Life's just going to be wonderful. And that's the thing too. Like if you accidentally forget to convert, and you always need to have the same units. If you're intermingling, if you're cross multiplying, if you're dividing, whatever, you need the same units. That's key. Otherwise, you would get the wrong answer. And we can actually attempt both answers, right? We can get the right and wrong answer, and you can see that they may very well be represented within these four answers. And you might mistakenly think, oh, I got it right, but you really don't. So we'll do the right answer first. So image size, we have 4 millimeters. Over, we're trying to figure out object size. We'll call it OS. And SID is 1,200 millimeters. And source to object distance is 880 millimeters. Great. Well, now what do we got to do? We'll map, if we're familiar with how to get object size alone on the side of the equal sign, we'll have to cross multiply. So cross multiply the object size. What we do to one side, we do to the other. Cross out here, we're left with 4 millimeters. All right, so now we need to further get object size alone on the side of the equal sign. So to do that, let's cross multiply this 880. So we're going to multiply that by both sides. What we do to one side, we do to another. And now we're left with and to further break this down, we're going to get finally object size alone on the side of the equal sign by dividing 1,200 millimeters from both sides. Oh, I did not do that correctly. All right, so now we can just do the math, right? So it's 880 millimeters times 4 millimeters divided by 1,200 millimeters equals object size. Cool. So I'm going to continue this equation up here. 880 times 4 gives us 3,520 millimeters squared divided by 1,200 millimeters. And don't get worried about the squared, millimeters times millimeters, right? Because they're going to cancel out. One of those millimeters is going to go away because we're dividing by 1,200 millimeters. It's all gravy, baby. All right, so now let's divide that by 1,200. And we get 2.93 millimeters. That's our object size. Yay, that's one of the answers. So the answer is B. We did it. So what if we plug these numbers in incorrectly? What if we did that? Okay, what would that look like? Just for the heck of it. Let's see if it's represented. This is like what not to do. So what not to do would be is all right. So we'll go through, we won't go through all the steps like we did before. We'll just kind of plug numbers in. So all right, so now we're just plugging in numbers, right? So the SOD is 88 cm times 4 millimeters. Again, this is not the right way of doing it. 120 cm. Look, notice the units don't match. Just following this thought exercise out to see what we get. 4 times 88. Well, it's probably going to be a really small number. Let's see. It's 352 divided by, oh, maybe, huh, and 20. No way. What? Holy cow. This works. Since it's the centimeters cancel out, you're left with just millimeters. Holy cow. We got lucky. So if you didn't do the conversion, you lucked out. It's okay in this formula. What happens is the centimeters cancel out and you're left with just millimeters and you get the same exact answer. Ho, ho, ho. The only time this would probably not work is if you needed to solve for this. Say you had, what if you tried to solve for that using these numbers? So 2 point, so you have image, size, object size, SID over SOD. You're solving for this. You're going to cross multiply SOD times image over object equals SID. Going to do object, crosses out, You're left with SOD and image size. Now, since we want this, we're going to divide by image size from both sides of the equal sign. That crosses out. Okay, so now we're left with SOD equals SID. Let's plug numbers in. SID was 120. So the answer we're looking for is 2.9. No. The answer we're looking for is 88 centimeters. That's what we want. All right, so we have 120 cm times the object size, which is what we just solved, 2.9 millimeters. No way. This is going to work. You don't have to calculate this. You don't, or convert it. I'm sorry, you don't have to convert it. Okay? Well, I'll be a monkey's uncle. 2.9. Oh, I lost my train of thought. The image, it's the object. The image is 4 millimeters. Okay, let's calculate it out. Wow. Okay, it's pretty good. I got, multiplying these two together and dividing by 4, I got 87. So I think that's very close to this, but it's centimeters because the millimeters cancel out. Interesting. All right, guys. Well, you can totally just not worry about converting to the least common denominator. Okay. Well, thanks for going through that thought exercise with me. Yeah, 2 more of these. All right. So what is the length of the photon block that is 15 centimeters from the source when it appears 9 cm in length on an image that is taken 130 cm from the source? Okie dokie. Well, let's go to our handy dandy equation, right? So it's, what is it? The object, the image is always greater than the object. Therefore, we have image size over object size. The image is always greater. Something is on top, it's greater than, right? That's how I'm going to remember that. Same here, source to image detector distance on top, source to object distance on the bottom, object image, all that good stuff. So using this formula, let's plug some numbers in, right? We're going to draw a little diagram because I love diagrams. So what is the length of the photon block that is 15 cm from the source when it appears? Okay, so electron block right here. There's some distance from the image detector. And it's going to be a certain shape. What will it be larger or smaller on the image detector? It'll be larger. So I'm going to draw a larger shape. It'll be exaggerated, but whatevs. This shape is on a little tray. Great. Due to divergence. So this is your image detector. This is your block. This is your source. This is your image. Call this the object, right? The block is real. It's the object. This image is what appears on the image on your screen. It appears to be a certain size, right? So let's read this. What is the length of the photon block that is 15 centimeters from the source? Okay. So what is the length of the photon block? So we're looking for object size again. What is the length of the photon block that is 15? All right, so we're finding object size. What is the length of the photon block? No, is that right? What's the length? That is, yeah, 15. So the source to object distance equals 15 centimeters from the source. And when it appears 9 cm in length on an image, so it appears 9 cm in length. So if I were to guess what the object size is of the photon block, would you say it is less than or greater than 9 centimeters? So we're talking photon block. Would the photon block be larger than 9 cm according to this diagram? No, according to this diagram, photon block would be less than. What does that do for us? Well, that means that it's not this answer. So at least it crosses out one of them. So that's a good little thought exercise. And then let's keep going on this problem. So what is the length of the photon block that is 15 centimeters from the source when it appears 9 cm in length on an image that is taken 130 cm from the source? Okay, so 130 cm from the source to the image detector. Because it's talking about the image is 9 cm in length. It appears 9 cm in length on the image when the image is taken 130 cm from the source. So it's referring to the SID, that is 130 cm. Okay, so now we got 3 bits of information, right? We got 1, 2, 3. We can start filling things in. Great. So what do you say we just like cross multiply? Nah, I'll do it. We'll do it the long way. It's okay. It's all good. So image size is 9 cm. We don't know the object size. We want to solve for that. SID is 130 cm. And the SOD is 15 cm. Great, we got it. Let's get this object size out of the denominator spot and all by itself on the side of the equal sign. We do that by cross multiplying. Boop, boop. Great. So now we're left with 9 cm equals 130 cm times divided by 15 cm. Well, object size is definitely not alone on that side of the equal sign by itself. Therefore, we need to do some more work. I'm going to cross multiply to get 15 out of the denominator spot. So 15 cm. Boom. Great. Now we're left, if I were to rewrite that, I would rewrite it as Almost there. Still not alone on the side of the equal sign by itself. Therefore, we're going to divide 130 cm from both sides of the equation. Great. If I were to rewrite that, it would be great. So now we can just do the math. What is 15 times 9? That is 135 cm squared over all right, great. So now we just divide a little further. Ooh. We have, if you do the math, 135 divided by 130 is 1.03. What do we do with the units? Well, that cancels out one of the centimeters, and we're left with just 1 cm. We have 1.03 centimeters. Letter C. Great job. All right, let's erase this and move on. All right. There we go. So it says a seed appears on an image measuring 15 millimeters. The actual seed is 9 millimeters. What is the magnification factor if the source to image receptor distance is 115 cm? Okay, well, let's draw this out. So just, at first I didn't quite get it all. So a seed appears on the image to measure 15 millimeters. Okay, so we're gonna draw this little diagram out. We got our divergent beam. This is our image detector. This is our source. And so we got a little table here. Now we'll just call this whatever. We got a person on the table, and inside of the person is an exaggerated seed. And that seed is going to show on the image receptor, image detector. It's going to show up larger or smaller? It's going to show up larger. Okay. So the seed appears on the image as measuring 15 millimeters. The actual seed length is 9 millimeters. So if this, it says this image of the seed appears, if it appears and if it's image related, it is image size. And then it says the actual, right? Actual. So if it's actual, it means it's real. It means it is actually 9 millimeters. That's the object size. What is the magnification factor? Ooh. This one might be easy. What is the magnification factor if the source to the image receptor distance is 115? Jeez, does that, oh, that didn't look nice. Source to image receptor distance is 115 cm. So do we really even need the, we even really need this formula? Yes, we're given 1, 2, 3 bits of information, but it's not asking for the SOD. It's not asking for that. All it wants is the magnification factor. And to get the mag factor, we only need 2 things of information. If we might remember mag factor equals, it's the whole reason why we can connect these 2 equations, right? It's the primary reason. It's image size over object size. Those are the 2 bits of information we need for mag factor. This is how we can connect and make this formula, is because mag factor also equals, it's like if they both equal the same thing, then they both equal each other. That's how we get this equation here. But forget about SID. They just gave that to us for no good reason. Let's just focus on this. So that should be pretty straightforward, right? What is the image size? Well, we said image size is 15. What is the object size? Well, we said the actual is 9 millimeters. So let's plug this in, right? So we have 15 millimeters divided by 9 millimeters equals, notice the millimeters are going to cross out. So we're just going to get a ratio. That's all we're going to get. What is that ratio? That ratio is 1.666, or let's round it to 1.7 to the 10th place, right? Which is letter C. That is correct. Way to go. We did it. And that concludes our discussion for tonight. Thank you for joining me. I'm going to wrap up on the 30th of May. So that is 2 Thursdays from now. It won't be the last time you guys see me. I'll be continuing to make content via my newsletter, as well as I'm offering private tutoring lessons. Please reach out to me just reply to my email saying you're interested in my tutoring lessons. We can develop a study plan that works best for you, free 20-minute phone call, and we can decide if you would be a good fit for my tutoring services before we pull the trigger. Also, I have created a online national study group for radiation therapy students. So you can join my Discord server for a subscription fee of $10 a month, where you'll be able to set Pomodoro timers and study for increments and blocks of focused time for 25-minute intervals with a 5-minute break, or 50-minute intervals with a 5-minute break, or actually a 10-minute break. Anyway, there will be leaderboards where you can track your study time, the time you spend on Discord studying, and compare it to other radiation therapy students. So you can get a little competitive edge, not really edge, but just a little competitive spirit if that's your jam. You can also talk to other students to understand where they're at in their studies, what they're studying, what they learned. Do you have any questions? And beyond the chat, the really strong feature is voice call. You can get on a conversation with someone over voice and make relationships, encourage one another, team up, find a study buddy, answer questions for each other. You could teach someone else. That's a fantastic way of learning, called the Feynman technique, notably coined by the scientist Nobel Prize winner Richard Feynman. Really excited about that. It's $10 a month for a limited time only. You can have lifetime membership for just $30. Feel free to reach out to me, respond or reply to my email and my newsletter. If you're not on my newsletter, you can find me at laurenjbrown.com and you can get on my newsletter.